June is Men's Health Month, and our friends at Encompass Health Deaconess Rehabilitation Hospital want men to know the risk factors for stroke. Blake Bunner is back with us. He is the CEO. Good to see you.
Hey, good to see you too. Glad to be with you today.
Well, this is important information, and not just in June, but year-round. Why is this topic in particular significant to you?
Well, you know, the month of June is Stroke Awareness Month here at our hospital, and for the community, a lot of people may not know that stroke is really the leading cause of death in men. And in fact, the CDC has reported that stroke actually kills as many people as prostate cancer and Alzheimer's disease combined. And that's a pretty big number. And a lot of people may not realize this, but in the midst of, as we start seeing summer come into play here, first day of summer's coming up. So we think about that is how do we take good care of ourselves and know exactly what's going on. And part of that is to make sure that you know your risk factors. Having high blood pressure is a huge risk factor. In fact, nearly half of men have high blood pressure, or they're either taking medicine to reduce that blood pressure. Smoking is another risk factor.
Right.
We all know that smoking is not good. Being obese, I know for me, I've had my weight go up and down, and the heavier I am, the harder it is to exercise and do the things outside that I enjoy doing. And I really don't need any more of these risks that put me in a situation to get a stroke. Having diabetes is another huge risk factor, and managing that with your primary care doctor is the way that you minimize that risk. And then consuming alcohol is another risk factor. Drinking too much alcohol can raise your blood pressure levels and increase the risk of stroke. And it also can increase the triglycerides in your body. That's a form of fat that can harden your arteries. And then again, like I mentioned, not getting enough physical exercise, whether that's walking or swimming or just getting outdoors and doing some chores in the yard. That is another way to get some exercise. But just knowing these risk factors is the first step in preventing a stroke.
But if the stroke does come, what are the services you provide to help people get back on their feet?
I'm so glad you asked, Angie. You know, right here at 9355 Warwick Trail in Newburgh, we have a world-class rehabilitation hospital. And we have been here now for almost 2 years, and been in the community now for about 32 years. But we have state-of-the-art equipment that allows our stroke patients to be able to get back to living again. The first thing we do is restore dignity with our stroke patients. Most people do not want to be a burden to their families, and for those that have suffered a stroke, they may not be able to have function of their arm or leg or one side of their body, or to be able to swallow. And these things are so important because nobody wants to be a burden on their family. Well, we teach our patients how to be able to take a shower on their own, to be able to get dressed on their own, to be able to transfer from maybe a chair to a bed, just to be able to do those things so they're not a burden on their family. And that's the first thing we do here at our hospital. The other thing is that while a patient prepares to go home, we also connect them with services in the community that will allow them to stay healthy and continue to heal and recover from that stroke. Of course, at our rehabilitation hospital, we have state-of-the-art equipment, but along with that, it's a team approach. It's an interdisciplinary approach that has physicians managing the care of our patients. Rehab doctors are actually here on site every day, 7 days a week. And we have an approach that includes not only your physical therapist, but your occupational therapist, your speech therapist, your dietitian, your caseworker, and a whole host of nursing staff to keep you safe along your journey here as you recover from a stroke.
Well, that's the place to be. Blake, thank you so much for being with us.
Hey, thank you, Angie.
More Lifestyles for you right after this.